want to really address the Tamil Nadu government. What are you doing, Anbil Mahesh? This is the situation in schools. Class 9, at age 9, this is really terrible. Dr. Srividya, who is Senior Consultant Physician and Medical Director, Apollo Preventive Health, is joining us, and also Sumitra Devi, Executive Director, Arvam NGO from Chennai. A very, very warm welcome to both of you. Vanakkam. Sumitra Devi, let me first ask you, this is shocking. I mean, tobacco is tobacco, whether you're chewing it, whether you're smoking as BD or smoking as cigarettes. But as early as class 9, because apparently during COVID you were, contained in a house and you started, but the long-term impact of it, I mean, it has myriad effects. Isn't that right, Sumitra Devi?
Yes, actually, like after COVID, the uses of tobacco have been very much increased in schools and even in the urban communities. As I work with the children's in urban community in North Chennai, so I see a lot of adolescents, even from the age of 10, 11, also use tobacco, like chewable tobaccos, the name called Cool Lip. It has been frequently used by the children in schools and communities also. One of the biggest issue is that Tamil Nadu still doesn't have a permanent ban on tobacco products. So this makes easily available near schools and even in the community, making children more vulnerable also.
Devi, in every cigarette shop, there is written
Yes.
that selling tobacco to anyone who's younger than 18 years is a crime. What are
Actually,
schools
as
doing?
of
Now, what are
yes.
schools doing? What is Anbil Mahesh? I am going to ask because I'm a journalist and I'm going to ask this. You, when POXO cases come to the fore, you say, okay, we give you a number, you talk to this, that, and the other. When there is caste slurs, they wake up suddenly. When now there is smoking, then there'll be drinking, then there'll be all kinds of things. There was gutka, which was banned, thank God for small mercies. But then what are authorities doing? Children have to be molded. Children don't learn on their own. They copy you and I. No?
Yeah, actually, as an organization, we also do address in multiple ways. Like we also use a tobacco monitor app, which is to help identify and also even uses report violence to quit tobacco and everything. We also do awareness programs on
Actually
schools.
not
But
working,
what
no
is the
ma'am.
use? What is the use of that?
Apps don't work. What really works is a bit of scare and a lot of love and affection. Dr. Srividya,
Yes.
please come in here. Dr. Srividya, can you imagine doctor at age 9? And I'm not going to go about gender because a lot of people will sit on judgment. Oh, girls and boys have the same lungs. Go ahead, Dr. Srividya. What are the long-term impacts of it?
So, smoking tobacco, like you're saying, they may not probably attempt it because it will be very obvious that they are smoking. But chewing tobacco is something which is very, very colloquial. It starts with parent. They see their parent, they steal from the father's or the mother's pocket. And they are also the messengers. They are also the fast ones who can go and quickly pick up a cigarette from the shop and all. And how does the shopkeeper, we are not questioning his morality. It is about him just selling it because he is making a fast buck. The long term or the short term complications are plenty, right from oral cancer to rising pancreatic cancer among women, breast cancer, all type of cancer, lung issues, everything is connected to smoking. Low infertility, memory loss. We cannot even imagine if it is going to start as early as 9-year old, but I am not surprised. I don't even think we can blame the COVID lockdown for it. This has been happening for a very, very long time. And let me tell you, probably tobacco is only the tip of the iceberg. There are plenty of many things which is happening around the schools because it is easy money. And who is regulating? There's no regulation.
That is the moot point. There is no regulation. I mean, in Delhi, there are schools where children are starting as early as class 7. And like you said, there are lots of things which are exotic and which are easily obtainable at a very cheap price. Sumitra Devi, I really appreciate the kind of work you do, but do you work with schools, with principals and teachers?
Yes, actually, we work with even schools. We also do mental health programs for the children to manage stress. So during those times, children used to share with us about like how tobaccos have been sold out in schools. Even the school management, like the school workers, sweepers, and all, they used to sell it. The local,
Fact.
even
They
nearby
should be
schools, petty
jailed.
shops also
They
easily
should be
available.
jailed. They should be sacked.
That's
Why
true.
is it there are no stories about jailing of such people? Is that a jail? In jail, this happens where, you know, I as a guard, I'm supplying
Schools
substances to
have been not
prisoners.
monitored properly, actually.
Okay. No,
The
but what do
most
you
of
do? No, no, Sumitra, wait a minute. You talk to the children. When you get feedback that, you know, maybe a peon is giving us or that Anna is giving us, do you complain back to the principal to say they are the culprits, or that's not your job? Do you go to the police?
No, yes, we go to the police. We also talk with the headmasters. We talk with the teachers. We talk with the children, and we also raises complaints. So we didn't get answered till now. We also do a lot of advocacy, lot of awareness programs. But like the question mark is, even then it has been selling in the community. It is easily available and it is also very cheap.